My guest today is Shauna Mugavero, and she's the program manager of healthy weight management and bariatric surgery in Lancaster, Pennsylvania. Shauna, thanks for stopping by. How are you?
Of course. Very good. Thank you.
All right, so let's talk about this is again the ProNex Inc. podcast special simulcast with the Neil Haley Show. And Shauna, explain how long you guys like not how long, but what how you use ProNex Inc. for for the surgery center.
Sure. So we are healthy weight management and bariatric surgery, part of Penn Medicine, Lancaster General Health. And I've been here for 13 and a half years. I'm actually a registered dietitian, and I was working with our patient population for a long time, became program coordinator of our surgical program. And that's where I started seeing some insufficiencies with tracking our patients through the program. We used to do it by hand, checking charts, making sure everybody had all of their qualifications that were needed for insurance verification and authorization. And there was a day that I was on a program coordinator work group, and somebody had mentioned that they use ProNex to organize and try to get their pipeline set up so that patients can get from start to surgery as quickly as possible and not have or necessary items fall through the cracks. So that's where I started looking into ProNex and seeing if it was something that would help our program.
All right, so that's very interesting, Shauna, because you're right. Tracking patients with HIPAA compliance
Hmm.
and being able to make sure that you have access to their medical needs information once they contact you. It's a great fit what Pronex is able to do, because what Pronex is able to do is add an EMR with the ability also to have a CRM together combined with that patient doctor communication.
Yeah, it's been really great just to be able to, patients can log on to see their progress and see their needs throughout the program, which doesn't always happen. So that's where, we can help out, and it comes up on a list every day. Oh, this patient didn't do this, or we need to check in to make sure they're doing this so they stay on track. And we reach out and just help them through the program that way. Because there's a lot of needs and homework assignments that are needed for authorization insurance. Some insurances are very demanding with the qualifications. And we just want to make sure patients are properly educated and get there as quickly as they can
Yes,
and
because
safe.
no doubt. And that education communication is so tough if you're dealing with emails back and forth or losing track. Having the software, you now have the ability to communicate that's safe, right? Safe communication back and
Yep,
forth and track them.
exactly.
Mhm.
Yep. Yeah, and in the past, we would have a couple months lapse because a patient would forget that they needed a requirement or a clearance. And now we can stay right on top of it and safely make sure that they're getting the clearances they need at the times that they need. It's been really helpful.
So what do you like most about utilizing the software?
I would just say it's user friendly from a standpoint of, we used to, number one, we used to do chart checks and see, does this patient have everything they need? And that's a lot of patients to keep track of when you have several hundred patients in the program. And then we went to spreadsheets, manual spreadsheets, and that was another very tedious task. Whereas this just auto populates every day. You put it to pop up and say, okay, this is due for this patient. And I would say the user friendly part of that, ensuring the pipeline goes smoothly, is our favorite feature.
It seems like a great feature because the user friendliness is such difficult when you use the software and you're confused about everything. And now you feel like you have really automated some of your manual tasks since you've been
Hmm.
using this. It's
Yeah.
so important. And there's so many people in the medical industry still, especially in the bariatric surgery, weight loss management, food is health, lifestyle medicine, that are not able, they're still tracking archaically.
Yeah. And I know that this program can be used even beyond what we're using it for. We just haven't embarked on that at this point yet. And when we have capacity to do, there's so many more options. And that's where I think it could be used for tracking post-operatively, something that we haven't gotten into yet. But all of these features that it at least offers, you can pick and choose what to use for your specific program and how to cater that, which is really great.
And you like also working with Fred and the team at ProNex Inc. because of the ability that they're very easy to get back to. They're very
Oh,
responsive.
absolutely. Yeah, and they've been so great with sharing new offerings that they have and new capabilities of the program and just keeping us in the loop with everything.
All right. We appreciate it, Shauna. This is great stuff. Where can people that are in the Lancaster area, because again, we put this on my radio show as well, are that are interested in learning more about you guys, where can they go?
They can go to the Penn Medicine website and look up healthy weight management and bariatric surgery.
All right, fantastic. And
Yeah.
everyone can go to pronexinc if .com if they'd like to test drive the software. Appreciate it, Shauna. Thanks again.
Yeah, thanks so much for having me.
All right, that was special simulcast, the Neil Haley Show and the ProNex Inc. podcast, guys. Take care.